All right, so question number 1, review the different types of incontinence. So we talked about stress incontinence, urge incontinence, overflow incontinence, and reflex incontinence. There's a table in your book that has them too. All right, question number 2 refers to renal stones. Review the education or interventions that you would give the patient who has renal stones. Remember, we talked about patients should increase their intake, right? Also, if they have known renal stones that they need to pass, what is something that we would make them do? How do we figure out if they've passed the stone or not? Strain it, yep. Question number 3, review indications for a urinary catheter. This one should be pretty easy. We've talked about that a lot. What are a couple? Surgery. What else?
Urinary retention.
Yep, that's a big one. So stuff like that. Okay. Number 4 is referring to UTI prevention. I feel like we had this question on our infection quiz. So just review that, proper way to clean, different hygiene things, hydration, that kind of stuff. Okay, question number 5 refers to removing a urinary catheter. So review those steps. There's also that video in your ATI that shows you exactly how to remove it. It's like a 3-minute video. But in that ATI module, it literally gives you step-by-step instructions, so I would review that. Question number 6 refers to urinary incontinence and just different interventions you would do to manage the client's behavior of incontinence. What are a couple of things that we would tell a patient to do if they have bouts of urinary incontinence, if they have like dementia or something like that? What are interventions we could do?
Remind them to go.
Remind them to go. What was that?
Bladder training?
Bladder training, yep. So put them on a bladder program, right? Pee every 2 hours or whatever. That kind of stuff. All right, question number 7 is about inserting the urinary catheter. So steps. So again, that elimination ATI module is really good to review. And we've talked about it a lot. Question number 8 is a tech is helping you with a indwelling urinary catheter. Review things that the nurse can delegate to the tech. So this wouldn't necessarily be like scope of practice. This question will refer to like what you should do if you're putting in a urinary catheter. So it's not saying like what can the tech do versus what the nurse can do. It's just saying in general, if you're telling a tech how to do it, what would you tell them? So if you know the proper ways to start a catheter, you should get this. Make sure you're reading all the questions too thoroughly. Some of the wording will be tubing versus the bag, right? So if you're securing the tube, where do you want to secure the tube? To the thigh, not to the bed. You want to secure the bag to the bed, right? So just stuff like that. So make sure you're actually reading the whole question. Question number 9, again, steps about how to do indwelling catheter. Question number 10, review urinary retention. What the following findings a nurse would expect for the patient with urinary retention. So findings also mean like signs and symptoms. Okay, question 11 is going to be the same as question 1. It's going to kind of go over just the different types of urinary incontinence, so make sure you're looking at those. Question 12 refers to a patient that's getting a new ileostomy and just therapeutic communication that you would make with the patient about this procedure. Question number 13, you have a client who has a new colostomy. So it's a colostomy, not an ileostomy. So review what information should be included in the teaching. Like I said, that book where it says patient-client teaching, I would review that. We've also discussed expected findings, so it shouldn't be new information. Okay, 14. Is referring to changing an ileostomy pouch. Just review unexpected findings or expected findings and know that if it's not expected, what we should want to report. So what's normal versus what's not normal when you're changing out an ileostomy pouch. So this will refer to like the amount of drainage and also stomas. So make sure that we know what is normal versus not normal. I'll also send you guys this recording. All right, question 15. This is going to be about, again, draining an ileostomy bag. So make sure you review the understanding of the procedure. Again, there is step-by-step instructions in your ATI module. You can watch the video, but within that video, it literally will tell you step-by-step of how to drain a bag. Question 16 refers to pre-op for ileostomy. I would review the pre-op instructions for ileostomy as well as where an ileostomy would be placed on the abdomen. So left lower, right lower, just make sure that you know where. (17) is talking about a gastronomy tube. So also this is like the same thing kind of as an NG tube, which we talked a lot about the other day. This is going to refer to when we should be flushing with warm water. So go back and review that. So it says gastronomy tube. Don't get that, don't let that word freak you out. It's NG tube as well. Like when should we be flushing? Question 18 is going to refer to hiatal hernias And also just dietary recommendations for someone that has a hiatal hernia. A patient has a bowel obstruction and they are given an order for an NG tube. This one will ask you pretty much the steps of putting in this NG tube, or what we want to do when we're placing the NG tube. Remember, I went through it on Wednesday or last week, I can't remember. Okay, now lots of constipation questions. So question number 20 is you're caring for an older adult client who has constipation. It's gonna ask you which of the following actions should the nurse take? So this is management of constipation. What are we gonna do? What are we gonna give them? What are we gonna do for this patient?
Offer fluid.
Yep, that kind of stuff. Ambulate, right? Maybe give them a stool softener. Add fiber to their diet. But also remember, before we add a prescription for something, we want to try to do things less. Remember, always less invasive to most invasive. Even though a prescription doesn't seem like it's invasive, we're still going to want them to do other things before we add a stool softener on there. So just keep that in mind. 21, you have another guy that's constipated, and you need to tell me what causes constipation. This one is a select all that apply. That one's pretty straightforward as well. '22, you have another client who's constipated. They're on bed rest. What interventions are you going to want this patient to do? So it's a lot of the same questions asked in different ways. So you're not having to, it's not new information. It's just kind of asking you in different ways of a patient with constipation. All right. 23, a nurse is now providing teaching to a client with constipation. Which of the following information should the nurse include? Again, the same stuff that we've been talking about. Increase PO intake, increase ambulation, increase your fiber. Add a probiotic. Stuff like that. What about hot liquids versus cold liquids? Do you guys remember? Do hot liquids help constipation? They do. All right. Now the opposite. Got a patient with diarrhea. So this specific question, you have a patient who has had diarrhea for several days. Just findings of which of the following findings would we expect? So remember we said especially for several days, what are we most at risk for? Dehydration. What are our bowel sounds going to sound like? Hyperactive, right? Because they're like going crazy. Always think about it like kind of bubble guts when you're like sitting in a quiet room and your stomach's going crazy and you're like, oh man, it's happening. Okay, 25, we've got a kiddo that has severe diarrhea. What is our following action is the priority? So let's go back to dehydration. Now we have a kid that is smaller and loses more faster, right? So we are worried about dehydration. Before we intervene in general, what do we want to do before our intervention? Let's go back to like ADPI. What's the first step we do?
Assess appearance.
Assess. Have you guys heard that?
No.
ADPI before? It's, what is it? Assess, plan, intervention, evaluation. I think I forgot something in there. But that's basically like, what is the nursing process? We always want to be assessing before we're going to intervene with something. So for this question, it's asking you what's the first step?
Priority.
Yeah. All right, 26. This diarrhea is still going on, guys. Now a client wants to know about what foods and beverages can cause diarrhea. What's one of the beverages that all of us drink, especially when you're tired and in nursing school? Which has what in it? Caffeine. I forgot an A in this. Anyways, hold on. All right, so you are preparing a specimen for a client for a guaiac test. What is this test gonna detect? Blood. Fecal occult test is what we'll call it sometimes. All right, now we're done with diarrhea. But now we have kidney stones. So 28, you are a nurse and you're reinforcing teaching with a client who has received treatment for kidney stones. The nurse should remind the client to increase intake of which of the following. This one's pretty easy. It goes back to kind of when we're teaching someone about getting rid of kidney stones or passing them, what we tell them to drink. Yes. All right, next question. You're planning care for a patient who has acute glomerulonephritis. Which of the following interventions should we include in our plan of care? So just go ahead and review that acute glomerulonephritis interventions, or what we should be medical management of this patient. Right, 30. Now we're caring for a school-age child who has acute glomerulonephritis. This patient has peripheral edema, meaning there's edema within their body and is now producing 35 mils of urine per hour. What would we anticipate the provider to prescribe? So something that we're going to, it's a diet order. So just review that. Think about edema. This one's easy. Think about edema and what we usually restrict when patients have any type of edema. Or you tell them to chill out on.
Sodium.
No salt. Because why? So just retain it, right? I'm the worst. I love salt. So I'm about to be real puffy here soon, probably. Alright, we touched base on this and I didn't want to add this question, but I had to kind of switch it up a little bit. So 31 is talking about a client who has a kidney transplant. We talked a little bit about rejection, but we didn't go super in depth of rejection. So indications of rejection of a kidney transplant. One of the most, I guess, common findings. Do Do you guys remember what that would be? So if you are having a kidney that works appropriately, it's normal for you to have an appropriate amount of urine output, right? So if you have a kidney that's being rejected, what are you gonna see in their output? Decreased, right? So remember, rejection and infection are not the same thing. All right, 32. A client or a nurse has a client who has metabolic acidosis. The nurse should realize which of the following contributes to the development of acidosis. So again, just review that. I've said it multiple times. Remember, what are you losing, the acid or the base? If it's acidosis, you're holding on to the acid, right? So meaning you're losing that bicarb base. If you've ever watched Simple Nursing, metabolic acidosis comes from where?
I hate these ones.
Your ass. So diarrhea. Uh-oh, I'm recording this. It's alright, we're all adults, right? So if you ever think about it, metabolic acidosis is diarrhea because you're losing that bicarb and you're holding on to the acid, whereas if you're vomiting, it's going to be the opposite. You're holding on to that base. But that's a whole nother lecture, just so you know. Okay, 33. Now we're getting into chronic kidney disease. So I want you guys to review the best indicator of fluid status. This next question, I want you to review what happens in the oliguric phase of acute kidney injury. It's in your book, literally in a table. It's in that PowerPoint as well. It says oliguric phase, what's going on there, and what you should do. $35. What is our normal output for urine? Okay. Oh, oops. Nothing. Whatever.
Gave us the answer.
36 through 40 are going to be math questions. Very, very simple. '41, we're talking about an exacerbation of ulcerative colitis. Which of the following is a priority with someone that has ulcerative colitis? Right. 42, we got a guy with kidney stones again. Just couldn't, get rid of these kidney stones. It's going to be about instructions that the nurse should include. How much water do we want a client to drink? Do you guys remember?
Is it
2 to 3. So if it's less than that, don't pick that answer. Okay, 43, we're talking about pyelonephritis. What is an expected outcome? Just review that again. We talked about it. I stood up and showed you where pain would be. And the next 6 did not print. Sweet. So I need a proctor test, but I will send you the others if I don't get time to tell you. But basically